Welcome, everybody, to the Directors Meeting for the Lincoln City Council for Monday, April 19th, 2021. In the back right is posted a Open Meetings Act, and we'll get going here. Any adjustments to the agenda, Madam Clerk?
A few adjustments and just some notes for clarification. Sections 1, we have item 1E, that is an application for a dine-out application for Kincaid Brewing, which is on private property. And there was a duplication in the bill number, so the item 1E has a letter A after the bill number 21R-144 to identify that application.
Is A, okay.
Okay. And then for sections 4, under public hearing liquor resolutions, just a item to note, item 4A is also a dine-out application, which is on public property. Okay, and then for public hearing resolution, section 5, item 5A, I received an email stating that the applicant may be will be withdrawing the application.
5A.
5A. And I did forward that information to our city attorney's office as well.
Okay.
I will be calling items 5B and 5C together. And then section 6, ordinance's second reading and related resolutions, I'll be calling item 6A as a standalone item for a presentation. And I'll be calling items 6B, 6C, and 6D together for a presentation. That's what I have on the agenda. I do have also one question. We have our pending list 9A and 9C, and I was just wondering if we will move forward on clearing any of those items off of the pending list in the future.
Would that be next meeting, or you do it at the end of the year, right?
We've done that before, we've done it before
A new,
the new council, so
okay.
whether it's all the same of us or not, we just remove it before that.
Is planning available to answer that question? I believe planning placed them on pending a year ago, more. Curious.
Once we take them off planning, correct, then they would have to go through all the hearings again?
Right, and they'd have to pay the fees again, so I'd like to know from planning if they've continued to have contact with this applicant or not.
Okay. We'll see if we get David down here at some point.
Before we make
Or
them,
before we get out, yeah, before we,
before we make them pay a whole new set of fees.
right.
I'd-
We can do that today, or we probably won't remove these for a couple meetings,
We've got
meetings.
We've got
We got time today.
We've got time, and then there's just a 2-week notice before we
Okay, good,
chuck them.
good call. Anything else, Madam Clerk?
No.
Okay, anything from the mayor's office? Any questions for the mayor's office at this time? Okay. We can move on. Any questions? Okay, Jacobs Engineering for the purchasing. Okay, we can move on to Director Lopez. Winter coat today.
Cold.
It's just because it's snowing. Yeah.
I might be a hardy Nebraskan, but I'm not that hardy. Our total number of cases in Lancaster County to date are 30,442. We had 17 additional cases yesterday. Our case average for the last 7 days was 38 per day. So our case numbers are going down, which, if you remember, I've said for 10 weeks we were staying pretty flat, so now we're beginning to see that decrease. Our current positivity rate is 5.4%. We were at 7.4% last week. The only thing that's a little concerning is our hospitalizations have gone up. And we know they're primarily younger age group, 55 and older, and some younger. We're also seeing, if you remember back in December, we started seeing more Lancaster County residents than outside of the community. And that's starting to change around now that we're a little over 53% of the individuals hospitalized now are from outside of Lancaster County. But our overall hospitalization is up just slightly. We still haven't seen a lot in the emergency room or urgent care, which is encouraging. To date in April, we've had 4 deaths. I wanted to mention, as of yesterday, we've administered 248,653 doses of vaccine. Of those doses, 154,906 were first doses and 93,655 were second doses of either Moderna or Pfizer. And all 105,463, or 42.9% of our 16 over population has been fully vaccinated. We did a clinic, last week was the drive-through clinic at Tufts, Nebraska site. They administered about 1,700 or a little under that doses of Moderna at that site. We also had second dose clinics at Bryan and St. E's on Saturday for those with underlying medical conditions. We had clinics Thursday and Friday at Pinnacle that were really full. We started seeing a lot of parents coming in with their youth to get vaccinated. In some cases, the parents were getting vaccinated along with their children, so that was really a great sight to see. We're going to be working to do, today we've been at the jail and we'll be at the City Mission tonight. Matt Talbot and the Gathering Place and the City Mission are partnering together to help bring individuals in to get vaccinated. So we'll be going to our county high schools this week and some of the private high schools to provide vaccination. And we're partnering with Three Rivers Health Department is going to provide vaccine at Malcolm and Raymond High School. So we're really excited about that happening. And tomorrow is the clinic at the Coliseum at UNL. So that's going to be the first time we really have walk-ins in addition to scheduled appointments. So UNL's worked really hard with all the other, with Wesleyan Union, Southeast Community College, Concordia, and Doane to make sure students know that they can come to that location to get vaccinated. I'll stop there.
That's great. Any questions for Director Lopez? Yes, Councilperson Raybold.
I think it's a little bit alarming with the hospitalizations going up. And it's a good thing that the positivity rate is decreasing. However, I don't know, do they track the individuals that are hospitalized? Do they say, have they been tested prior to their hospital admission as a positive? I mean, have those that have been hospitalized, have they been tested prior to being admitted to the hospital? Because I wonder, with the hospitalization rate increasing, have those individuals tested positive? And are we seeing all the positive numbers out there?
Yeah, I think we are, because we're not seeing very many people come into the ER.
Okay.
Are the urgent care centers, and we would see that. The positivity rate at the university has been really low, like under 1%. So, and remember I was saying that we see more coming in from counties surrounding us. Mm-hmm. So I'm going to try and find more information out from the hospitals on that. We know that we've had a high uptake of vaccine, but seeing that hospitalization and the age grouping really points out to the real reason we need to get people vaccinated, because our cases have dramatically fallen in the 65 and older.
So those that are hospitalized, are they under 60? To the
I
best of
can't
your-
say that on these that I just got the report on,
Okay,
but that's a question we always ask.
okay, thank you.
Any other, yes, Councilperson Schob.
Thank you, Mr. Chair. Thank you, Director Lopez. I kind of want to springboard off of Councilman Rabel's question, just a little bit, not a lot. But a couple weeks ago, I didn't feel well. I went and got tested because I wasn't sure. My test came back negative. But I think I'm concerned that people who we self-select, that are being tested, it's not really a random sample of testing. So are we missing a lot of people that are positive that aren't showing up because they don't think they're sick enough to be tested?
Well,
Yeah, I'm worried we're still missing people.
Well, I think that's always a possibility, Councilman. I do think, though, that people have self-selected for a long period of time about who's going to get tested. But eventually, what we would know, we'd have more cases in general, because even if some people self-select not to, other people are going to get tested. So we would see that outbreak. And the other thing is, the university is doing thousands of random tests a week. And so those are truly randomized testing. And they represent a good perspective of our population.
Thank you. I did not know they were doing that.
Yes.
That is helpful to know. Thank you.
Yes.
Got one more over here.
Yes, Councilperson Washington.
Director Lopez, I have a question about variants. I noticed the weekend's report showed a greater number of variant cases in Lancaster County, including the South African variant. I realized that was only one. But can you talk a little bit about the variant numbers? And I know in some areas, positivity is going down, number of cases is going down, but the percentage of those cases that are variant is rising. What's happening in Lancaster County?
Well, we're looking at those cases. You know, the UK variant is by far the most popular variant, and that's the major one we have. The South African variant, we had the first one, you saw that in the state. That was purely, at this point, you know, I'm not saying that we're going to have more. But we tracked that down to a travel situation. That was in a state where that variant was really evident. The UK variant, we think now that they're doing sequencing, you're seeing more of the variant, that it's been there. But now that they're doing sequencing on, like I'm talking about all these randomized tests that we're doing, and others that they've started doing it, we weren't testing for it before, so we really don't know how much the variant was there before. But we do know that with the UK variant, people haven't been seriously ill. Most of the cases that we've seen, I can't say all because I haven't asked for sure on all. I randomly ask if people have been vaccinated that have the UK variant. But these are generally people going in to be tested because they have symptoms.
Thank you.
Any other questions for Director Lopez? Thank you for coming down.
Big thank you. Keep up the good work.
Okay, we'll skip the board reports. Everyone saw the constituent correspondence that we've received. And then we'll go down into a couple discussion items, and I was the one that added these to our agenda at the end. I was wondering if we should start to have discussion about the crowd size or the chance of opening up some seats in here.
Yes, please.
If you think you want us to go ahead, and I'll start the discussion with our county board and planning commission members, and we can try to come up with some ideas, and then I'll get back to you probably before next week if we can get it implemented prior to next week.
Yes, please.
And part of that, maybe we'll have health department just giving us an idea of what we should and shouldn't do with some of these, but I think we all know the drill pretty much by now about distancing and such. Okay, the other discussion was one that Tammy had brought up. It's very good that we should start trying to figure out ways to get at least as much as information as we can as early as we can to all the members. I think Tammy was right. It was kind of disingenuous of bringing things forward at the last second without having everybody a chance to review them. Now, that still doesn't mean we may make amendments or motions to amend as we go along once we get into it. But I think it's good for the public and good for us to be able to look at these amendments ahead of time and discuss. So I was just wondering what you were thinking for timing. I've been throwing out the idea that if we can get anything in writing, and sometimes it's not real easy with our legal department to get things written up the way you want them, but maybe drafts and such ahead of time by either Thursday evening or before Friday would be the best. That way we would have a chance on Friday or over the weekend to look at them and have discussions. You want to come forward a little bit? I mean,
Sure.
you know what
mentioned-
we do. We always come up on Monday morning and say, will you draft this for us?
Sure, and you mentioned the law department, so I figured I would stroll up here. We would request, I think, Thursday, and I understand that that's not always possible for various reasons, right? I think we all understand that, but I think that if we could have it by Thursday, then that gives us a business day to try to turn it around. And then that way the council can see it Friday over the weekend. If we're able to turn it around on that time frame, it could also potentially be published during that time frame as well. So
Could we be a little bit more specific about the time, when we needed to request to law so that law could publish this? Because I think part of it is, yes, we want to be informed before Monday afternoon, but if we're going to publish this for the public's purview before Monday afternoon, how much time do you need to craft a motion?
And so, a business day is what we would be asked for. So if we have it by Thursday, we could hopefully turn it around by end of business day Friday. So I'm saying potentially it could be published, that it's not always going to be able to be published online as an attachment. But
So Thursday noon?
well, sure, I was actually just saying by the end of the business day Thursday.
Okay.
So
All right. I mean, I am looking at your eyes. I'm trying to make eye contact. No one's-
One of my thoughts was if we
I like
wanted
noon,
it
though.
to
I
be
mean-
published when we first release our agenda, and that should be, the actual document needs to be to Madam Clerk by 2:00, by just afternoon on Thursday, right?
yes, because I think
He wants
Thursday,
to-
and she's not here, but Thursday at 2, I believe, is
It's when she sends it to the newspaper
correct.
to be published. Now, that doesn't say she can't add it at a later time to the agenda. It just won't be published as part of the
agenda item
newspaper.
is there, right? The agenda item will be there and be published.
Yeah, and if you go online, you'll see she can add it to the online agenda after the fact. But if we could get it published publicly, yes.
Well, I think that's a really good goal, but oftentimes amendment may still be in production, depending upon the various departments that you have to go through and get their input on it as well. Besides law, it might have to be planning, it might have to be building and safety. And it's important that they have a chance to review it first. Or after law crafts that they have to review it first, just to make sure it makes sense. So, you know, I like Johannes, if we get something to the law department by the end of Thursday. I think what's really important prior to that is the communication with our colleagues about what we're trying to accomplish, and give our colleagues enough heads up in saying that, hey, this is the draft I'm working on. I don't know if I'm going to have written amendments ready to review, but this is the gist of it. And I think that's essential, that we have that at least circulated to our colleagues at least no later than Thursday, close of business to them, knowing and telling them that law is working on a final version, as well as planning or something like that, so that there's enough of a heads up. And then hopefully it gets turned around over the weekend so we can give it to Sunny, and then Sunny can make sure it gets posted as an amendment. It would be ideal that if we could get it posted as an amendment, by the end of Friday day, but oftentimes I don't think our work schedules permit us to do as much detailed review and analysis until the weekend. So I think the most important thing is we keep our colleagues in the loop, and then, of course, we want to make sure the public has an opportunity to come and testify on an amendment at the time they come before us. So,
Okay. So I think we'll do, it's just got to be a practice, I believe, of us, that we can get it and share it. And make sure everybody's aware of it, of what it is, even if it's not finally drafted. But we need to, some of us need to do a better job of informing everybody of what they're working on, even if you don't have the final draft and you're still working on it. I agree, Councilwoman. That would be great. I'm just saying that a few of us need to practice that. And we'll keep working on it. I see Director Carey's in the building. If you'd like to come up, we've got a couple quick questions for you about removing some items from pending. Did you hear that?
I was made aware that that discussion was happening, so I got back to the building as fast as I could. Thank you.
Okay, thank you. Yeah, you want to go ahead? You were asking the
Yes,
questions?
sir. So, Mr. Carey, we have 3 items on pending. They're related to each other, A, B, and C. And they've been on there since, 13 months ago.
Correct.
Can you refresh us why they came off of the agenda? And if you've been in contact with them in the meantime, and, do they want to come back?
Yes, so very good question because of the timeliness of it, or lack thereof, I guess. There is intention for that project to actually go through the process and get approved still. What's happened is, or what did happen is that there was a timing concern with the other developments around it, and there was a desire for that property owner to wait for some period of time to see how everything else is working itself out. But there is no problem with this project, and they do intend to come forward. We have been in touch with them a few different times over the last several months just to make sure that everything was okay and to confirm that they were still intending to move forward, and they have expressed that back to us more recently. I can certainly follow up again because it has been about 2 months since the last time we asked directly if everything was still on track.
Yeah.
But I don't have a good answer for exactly why there's a desire to keep it on pending for now, but that is their intent for now still.
Yeah, I don't know, chapter and verse here, but I think there's a protocol issue about the close of council. And we don't usually carry items over from one council to another, and so.
Right. Yes, so this is the time to get a final answer, one way or another.
And they're certainly welcome to start fresh
Right,
again, but.
correct.
And that was one of the questions.
Cost them
If they
some
start
money.
fresh, do they have to go through planning commission, file fees again, pay fees again?
That would be the normal protocol, yes.
They would have to start all over again.
Correct. Now, it would not necessarily be overly complicated since it would be basically the same information, but if they do formally withdraw, then they would have to formally reapply.
If we take it off of pending,
If we kill it, yeah.
if we kill it. What if we decide to take it off of pending and just remove it?
Well, certainly that could end up being the actual step that's taken, but I think that still, if they still intended to move forward with a project, they'd have to reapply, and it would be the same situation.
Jane has a question.
Yes, Jane?
yes, to get more technical, so we're having elections on May 4th, and the new council gets sworn in
2 weeks later.
2 weeks from that day. So they have up until that time to make a request to remove it from pending? Or how
Well,
does that work?
I would say, I think it depends on how you as the council members feel about this. Is the issue that this council wouldn't necessarily take action on it, or is it that just the idea of carrying over something?
It has been the practice that as we close out the business of this council, looking into the next council may look exactly the same.
Right.
Okay, but as we move to the next council, traditionally removed everything from pending,
Yes,
no date certain.
right. And I think that's a good practice. I do think that's a good practice. I just, this one might have some unique features
Yeah,
to it that
there was a point in time when we had like 10, 15 items that just hung
Yeah.
out there on pending, no date certain. And, yeah,
Well, I do think it's the right time to ask that question again of the applicant, and I will do that. And then, based on that answer, we can go from there.
Okay,
Thank you.
Thank you.
thanks.
All right, thanks.
Any other items that we should have a discussion on? Is there any directors that anybody would like to speak to?
I would think just to follow up on that thing, it's been the practice in the past to wrap up all of our business on anything, so that somebody's not in a position of having a hearing one week, and then they take a seat on the council and have to vote on something they've never heard officially as a council member. So we've tried to avoid that in the past, so I'm sure that will continue.
So at some point, we take off anything that'd be
Or we
second reading prior to a new
Conclude it.
council being sworn in.
We usually conclude and vote on it that day. That meeting that day has two separate meetings. We meet, conclude all the business, adjourn, and then meet again the same day.
Like
Well,
we did when we were
After the
sworn in,
new
yeah.
people get sworn in. yeah.
Yes.
Like we did when we were sworn in.
Okay.
but Is that not up to the chair to work with? I mean.
That's-
We have to
don't
work on
really-
the agenda to make sure that
Yeah.
it's cleared then.
Yeah,
Yep.
Yeah.
yeah, because
I'm
we
going
don't
to
really
leave
have,
that to Chair and Madam Clerk.
Yeah.
Who can,
and the
and
administration,
the administration
Vice
to
Chair.
we don't have a,
finagle
Oh.
that.
we don't have a lot of say in it.
Okay, thanks. Give it something else to do.
Yeah, there you go.
You're not working hard enough.
No, I know.
But did you have a call for who would like to speak to what directors?
Yes, I just did.
David Carey, please.
David Carey? Anybody else? I'd like to talk with Chad Blaha and maybe Parks and Rec briefly. You two? Okay. Chad and David.
Well, I don't want Chief Jackson to feel out of, lonely.
He's here, so you might as well talk to him.
And I'll talk with Dan too, since he's here. Well, that just leaves
Is that Chief Jackson in the
Director
back? I
Elliott
didn't
all by
recognize you.
herself.
I didn't recognize you with your mask. I'd like to talk to Chief Jackson too.
Chief Jackson too?
Yeah. Now that I recognize you.
Maybe I'll talk with Pat Lopez too. if She's still here.
Everybody stick around a while.
Yeah.
We'll get to you. Yeah.
Okay, anything else for the directors meeting? Okay, we stand adjourned.
Here you go.